At the beginning of this course, we talked about the different epidemiological traditions that have developed over the years and have been incorporated into research on substance use disorders. And we've spoken about the use of psychiatric interviews, which comes from psychiatric epidemiology. And we've talked about the harmful effects of different substances, particularly cancer and heart disease in the case of alcohol, HIV infection in the case of drugs, which has developed out of a tradition of chronic disease epidemiology and infectious disease epidemiology. Today we're going to talk about how social epidemiology can be very useful in terms of the methods that have been developed in helping us to understand the development of substance use disorders and their prevalence and how they can be prevented. And in particular, we're going to talk about risk and protective factors. Social epidemiology can be looked at in terms of a continuum. And if at the far end of the continuum, we're talking about morbidity and mortality, the development of disorders and diseases, as well as death rates attributable to them. We want to understand how social factors contribute to mortality and morbidity. And we start with what is called social structure. This is the environment around people who are exposed to different types of substances. And social structural factors can either increase or decrease their access to psychoactive substances. So that is an important variable that needs to be taken into account. Within social structures, people have a position, and we've talked about measuring occupation and socioeconomic status, access to resources. All of this affects substance use disorders. And then we get down to the individual level, other social factors come into play that we'll talk about in a minute. But in particular, family and peers play an important role. And we also need to take into how social structure, the individual's social position, their psychosocial behavioral risk factors interact with their biological makeup. But social epidemiology helps us to understand what goes beyond biological factors. And the reason this is important, because there has been emerging evidence, particularly from social epidemiology, that income inequality that occurs within a society, both in terms of social positions and power structure and in terms of income, has a very profound effect on people's health. And that is true of substance use disorders as well. We also want to measure these variables because of the fact that psychosocial factors can be significant in protecting people from exposure to different substances. So, an example would be the social epidemiology of prescription drug use and the epidemic of prescription drug use that has been observed in epidemiological data in the United States, and how that's related to these risk and protective factors. At the social structure level, risk factors might include, in the case of the opioid epidemic, overproduction and aggressive marketing of opioid pain medications, as well as on the illicit market, the availability of cheap heroin. So where you live, what your social position is, what your socioeconomic status is going to have an influence on how the social structure influences your exposure to opioid pain medications. And psychosocial variables are important to take into account here too. Personality factors like aggressive personality, attention deficit disorder, different types of risk-taking behavior that go with temperament, all can increase a person's likelihood of becoming involved in psychoactive substances. Illicit drug use is affected by social networks in particular, the person's early family and parental experiences. These often, for drug users, have been found to be traumatic, and traumatic events that occur in a person's life can lead to the development, particularly the early onset of substance use disorders. Parental drug use not only provides poor modeling, but it also provides a chaotic home environment. Peer modeling for the initiation of drug use and social influence into the use of drugs is an important social network risk factor. And social networks also can socialize an individual into a drug-using lifestyle because they need to learn where to get the drugs, how to use them, and how to hide their effects. Finally, we've done research that shows that the larger the individual's social network in terms of its size and its density, the more that people use substances more frequently, particularly if that social network contains people who are using drugs themselves. So, taking into account these different types of risk factors, is it possible that the social structure itself can provide the conditions for the development of a drug epidemic? In the United States, the combination of medical enthusiasm and promotion through aggressive marketing by pharmaceutical companies has led to a substantial change in the way that the medical community prescribes opioid pain medications. And by the 1990s, the regulations that were often used to restrict access to powerful pain medications had been relaxed. And medical schools and physicians' organizations were changing their attitudes about pain management. And with that came aggressive marketing of much more powerful opioid pain medications. So we, at the same time, had many different types of psychiatric disorders which were being treated with pain medications. Attention deficit disorder was being treated with psychostimulants, and anxiety disorders were being treated with tranquilizing drugs. And the use of opioid pain medications was being used for a variety of medical conditions. The consumption of these types of drugs increased dramatically in the United States during the 1990s. And the use of these drugs became so prevalent that in the United States, people in the general population were consuming 5 times as much of these drugs as were people in Europe and other parts of the world. And in some cases, the use of these medications was non-existent in other parts of the world, but was increasingly dramatic in the United States. There were a number of explanations as to why these drugs were not only being used, but abused within the general population. And one of them was that for some reason they were being diverted by criminal activity within the legal market through diversion from the factories or thefts of pharmacies. But the investigation of this particular source of leakage within the prescription system has shown that it really doesn't account for more than 5 or 10% of the market for pain medications that exist in the illicit market. What was found in a series of epidemiological studies is that the distribution of these substances occurs on two levels. One is overprescription to patients with short-term indications for pain, which provide them with more drugs than they need and more frequently than they can use. And once that occurs, you get leakage within the general population. So young people get access to them, people trade the drugs, and before long, the availability of opioid pain medications is quite pervasive. And that is certainly the case with large numbers of young people reporting easy access to these substances through friends and family. In relation to, or in contrast to the risk factors that occur at the structural level and at the social level, we have protective factors that may prevent people from exposure. And the key protective factors that have been investigated in different types of psychosocial research are religion and religiosity, a strong nuclear family, parental monitoring of young people's behavior, and self-control characteristics in individuals. Some of that is due to personality, some of it is due to training. What all of this implies is that risk and protective factors can be used to understand how an epidemic gets started, how it progresses, and perhaps how it can be reversed. And social network interventions that occur at the structural level, at the level of the social group itself and within the network, can be quite effective in protecting people if we have a proper understanding of risk and protective factors. And what you're going to be encouraged to do in the remainder of this course is to begin thinking about how you could design an intervention to take what you've learned in terms of risk and protective factors for particular problems caused by alcohol and other substances, and evaluate the effectiveness of that intervention in a study that would use appropriate research designs.